Hello and welcome to the topic Approach to Shock in the Internal Medicine module. By the end of this session, you should be able to define and explain the concept of shock, classify shock into the following categories, which are septic, anaphylactic, hypovolemic, neurogenic, and cardiogenic shocks, outline the early recognition steps and management of shock, describe the monitoring that should be done in a patient with shock, and finally discuss the complications of shock. Let's get started. Shock is most commonly defined as the life-threatening failure of adequate oxygen delivery to the tissues and may be due to decreased blood perfusion to tissues, or inadequate blood oxygen saturation, or increased oxygen demand from the tissues that results in decreased end organ oxygenation and finally dysfunction. If left untreated, shock results in sustained multiple organ dysfunction and end organ damage, if with possible death. There are many ways we can classify shock. This is one of the methods of looking at shock and its respective subcategories. There are three main components that can be affected in shock, which could be the blood or circulating component, vessels, which refer to the caliber of the vessels, and finally, the heart, which is mechanical in origin. Decrease in circulatory volume leads to hypovolemic shock, and the decreased ability of blood to carry oxygen to the tissues lead to dissociative shock. Examples include carbon monoxide poisoning and anemia. Types of shock that involve the vessels is the distributive type, which are neurogenic, anaphylactic, and septic shocks. And finally, mechanical issues, which refer to cardiac dysfunction, can be secondary to psychogenic, cardiogenic, or obstructive in nature. Let's take a quick look at the pathophysiology. So shock is an acute, widespread reduction in effective tissue perfusion that invokes an imbalance of oxygen supply and demand, anaerobic metabolism, lactic acidosis buildup, and if prolonged, irreversible damage and death. The pathophysiologic events in the various types of shock are different and complex, with hemodynamic oxygenation changes or alterations in the composition of fluid components and various mediators. Mechanisms may involve decreased circulating volume, decreased cardiac output, and vasodilation, sometimes with shunting of bloods to bypass capillary exchange beds. So the 8 main causes of shock can be due to heart conditions or heavy metal or external bleeding, dehydration, infection, severe allergies, spinal injuries, burns, or persistent vomiting or diarrhea. So there are 3 phases of shock, which begins with compensated, followed by decompensated, and lastly irreversible. Compensated shock is the phase of shock in which the body is still able to compensate for absolute or relative fluid loss. During this phase, the patient is still able to maintain an adequate blood pressure as well as brain perfusion because the sympathetic nervous system increases the heart and respiratory rates. The signs and symptoms of compensated shock include restlessness, agitation, and anxiety, which are the earliest signs of hypoxia, pallor and clammy skin, and this occurs because of microcirculation, nausea and vomiting when there's decrease in blood flow to the gastrointestinal system, increased thirst, delayed capillary refill, and narrowing pulse pressure. Next would be decompensated shock, which is defined as the late phase of shock in which the body's compensatory mechanisms are unable to maintain adequate perfusion to the brain and vital organs. So this happens when there is decrease in blood volume more than 30%. The signs and symptoms of decompensated shock include alteration in mental status, tachycardia, tachypnea, weak to absent peripheral pulses, a decrease in body temperature, and cyanosis. And lastly, irreversible shock, which is the terminal phase of shock, and once the patient progresses into this phase, it is of no point of return because there is a rapid deterioration of the cardiovascular system and the patient's compensatory mechanisms have failed. The patient will present with severe decreases in cardiac output, blood pressure, and tissue perfusion. Initial symptoms of shock may include weakness, tachycardia, tachypnea, diaphoresis, increased thirst and anxiety. This may then be followed by the severe clinical manifestations, which are confusion, unconsciousness, or cardiac arrest as complications worsen. These are examples of investigations that can be carried out in a state of shock. You may do bedside examinations or tests such as ECG to look for any cardiac dysrhythmias, echocardiogram to evaluate the function of the cardiac system, your arterial blood gas, which will also indicate the lactate levels. Lab investigations that can be done would include a panel of full blood count, renal profile, liver function tests, cardiac markers, blood cultures and urine cultures. And lastly, for imaging studies, you may do a chest x-ray, abdominal scans, CT scans, and maybe an urgent MRI of the spine if one is suspecting a spinal injury. So essentially, all these tests are directed towards achieving a diagnosis and also assessing the severity of the problem. Depending on the type or cause of shock, the treatments differ. In general, fluid resuscitation is given with an intravenous access in the ambulance or emergency room, and that's the first line treatment for all types of shock. The practitioner will also administer medications such as adrenaline, noradrenaline, or any other types of inotropes to try to raise the patient's blood pressure to ensure the blood flow to the vital organs. Important tests has to be carried out while resuscitation takes place, and this is to determine the underlying cause of shock. Septic shock is treated with prompt administration of antibiotics, and most often they are all dehydrated, hence requiring large amounts of fluid to increase and maintain blood pressure. Anaphylactic shock is treated with diphenhydramine, adrenaline, steroid medications, and antihistamines. Cardiogenic shock is treated by first identifying the actual problem. So in cases of myocardial ischemia or infarction, a patient would require cardiac catheterization to unblock an artery. However, in a state of congestive heart failure, the patient may require medications to support and increase the force of the heart's beat. As for hypovolemic shock, it is treated with fluids in minor cases but may require multiple blood transfusions in severe cases of bleeding. And lastly, neurogenic shock, which is the most difficult kind of shock to treat. Damage to the spinal cord is often irreversible and causes problems with the natural regulatory functions of the body. Besides fluids and monitoring, immobilization and anti-inflammatory medications such as steroids are suggested, and at times surgery can be main parts of the treatment as well. So what is the outlook for shock? The outlook depends on the cause of the shock, the general health of the patient, and the promptness of treatment and recovery. Generally, hypovolemic shock and anaphylactic shock respond well to medical treatment if initiated early, while septic shock is a serious condition and it carries a high rate of mortality. The sooner the infection is treated and fluids are administered, the greater the chances of recovery. Cardiogenic shock has generally a poor prognosis, and it has shown that only a third of the patients survive. As for spinal shock, it has very poor prognosis because the spinal cord mediates so many important bodily functions. So what is the surgical management of shock? Sometimes prompt resuscitation measures are necessary to reverse the state of shock and to avoid permanent organ dysfunction. So in cases where if there is massive bleeding, especially from the gastrointestinal tract, urgent identification and halting the bleed is necessary, which may require surgical intervention. Among the complications of shock would include cardiopulmonary arrest, dysrhythmias, stroke, ventricular aneurysms, renal failure, thromboembolic conditions, multi-system organ failure, and death. In summary, it is important to recognize the manifestations of shock and immediately be able to classify them, and this will assist in the initial workup and management to reverse the imminent condition and prevent potential complications that can set in. So we have come to the end of this session. We hope the session was insightful, and thank you for your time.